Well, in East Africa, a Kenyan judge on Monday ordered officials from the National Doctors Union to be jailed amid a strike against public hospitals that has been in effect since December. The court also declared the strike illegal in December. As news of the ruling emerged, riot police took up positions and doctors wearing white gowns and surgical caps blew whistles and chanted angrily in the street. In January, Justice Helen Wasilu sentenced the strike leaders to jail for ignoring her earlier ruling, but suspended the sentence to allow time for talks. The union, which has about 5,000 members, wants the government to implement a deal agreed on in 2013 to give doctors a 150 to 180% pay rise on basic salaries, a review of working conditions, job structures, and criteria for promotions, and to address understaffing in state hospitals. Now, for more on the Kenya's doctors' strike, VOA's East Africa correspondent Jill Craig joins us live via Skype from Nairobi, Kenya. Jill, there was a deal, as we've just mentioned, way back in 2013. What has prevented this deal from being implemented, as far as you know?
Yes, it's a bit of a complex situation, Vincent, with neither side very happy right now. And as you mentioned, in 2013, there was a collective bargaining agreement that was signed by both the doctors' union and the government, which did agree to higher salaries for doctors and better overall working conditions. However, the part that is becoming a bit nebulous is that what has happened is that the Senate Health Committee says that the permanent secretary who signed that CBA back in 2013 was actually demoted from his position 2 days before he signed it, thus rendering the document void. Now, the doctors say this is ridiculous, and they still signed this agreement in good faith. And as you mentioned, they are asking for a 150 to 180% salary increase. The government, on the other hand, has said that they'll go up to 40%, but that's it. So you can imagine that when we're dealing with numbers here, 40% to 150% minimum, it doesn't lend itself for a lot of agreement between the two parties. And so therefore, now we're in the situation that we are with 7 doctors' union officials being jailed.
So is the question here lack of finances, or is it that the government no longer really wants to honor the deal as it was in 2013 when it was signed?
That's a great question. And depending on who you talk to, you'll get different answers. The government says they don't have the money. They say that they simply do not have the funds. However, cynics and other people who've been protesting say, well, you had the money to have millions of dollars stolen from the Ministry of Health, which was another huge corruption scandal that people were protesting months ago. So therefore, where's the money now? And then also it's worth noting that, the nurses have threatened to go on strike. We have the university lecturers that are on strike. And so I think the Kenyan government has said that they're worried that if everybody is going on strike and everybody wants more money, there's no way they can pay for this.
What has been the reaction, particularly from doctors and others who sympathize with them? Will this jail term stop them?
It's interesting because a lot of people are upset I should say some people are upset at the doctors. They think they should go back to work and start helping people that need life-saving treatment. However, a surprising number of people that I've seen on Twitter and talked to in person have actually sided with the doctors. And they say, you know what, the government needs to do what they said they would do and uphold their agreement with the doctors' union in 2013. So actually, the doctors have gotten a lot of support from, of course, both within their 5,000-strong doctors' union, but also with a lot of the ordinary citizens of Kenya. They actually support the doctors in this.
And this has been what? It's coming to two months or more. What has been the situation at the hospitals?
Oh, yes. Well, March 3rd would be the 3rd month if we get to that point. But as a result, the public hospitals right now, no doctors are working. So that means the nurses have sort of picked up the slack. They're the ones handling things. And the patients, though, if they have the money or if they can actually, find some loans to get the money, they'll go to the private hospitals. But this puts them in more debt. This also means that the private hospitals are more crowded. So the public healthcare system right now in Kenya is quite grim.
And we hear that politicians, especially those who are in parliament that is coming to an end sometime this year, they're asking for more money. Is that one of the other issues that citizens are raising?
Yes, it most definitely is. And, like I said, there's several groups that either are currently striking or are threatening to strike or have recently been striking. So with all of these groups striking, I think that the union is saying that the starting salary for a doctor in Kenya is about the equivalent of $350 per month. So when you have someone striking because they want an increase of what they're currently making is $350 per month, they look at the MPs that are saying they want, another increase, and they're already quite large salaries relative to both the Kenyan populace and then also other legislators across the continent and sometimes even the world. You can see how sometimes these protesters get very upset at what they say is hypocrisy.
Right. Jill, thank you very, very much for your report.
Thanks, Vincent. Thank you.
That's VOA's Jill Craig reporting live from Nairobi via Skype.